Hello, my name is Dr. Lars Erik Larson, and I'm a chiropractor. In the next 30 minutes, I'm going to review some fundamental health information that's applicable to everyone. Some of my talks are very specific, but they all involve basic health tenets. My mission is to educate and check as many individuals and families in my community in regards to their spinal health and those conditions associated with spinal health. Today's topic will be living with a healthy back. Now, I've prepared a slideshow, and let's start by taking a look at our very first slide. Today we'll discuss the topic of healthy backs and also low back pain. How can we prevent injuries? How can we maintain a healthy back? These are some of the things that we'll talk about, and we'll also discuss treatment options and how to prevent injuries and re-injuries to an injured back. Let's take a look at our next slide. As you may know, back pain is an epidemic. It's estimated in some research journals that 8 out of 10 of us will experience back pain. My experience has been over a lifetime that 10 out of 10 of us will experience back pain. But how many of you are out there right now thinking, my back's fine, it doesn't hurt? How many of you have never had symptoms? Do you really know what the health of your back is? Today we're going to discuss what makes a healthy back. So let's take a look at our next slide. Low back pain is estimated costs the United States anywhere between $50 and $75 billion a year. Now, what do we need to do in order to maintain a healthy back? I have a spine that's right next to me here, and let me pick this up and show you some of the structures. One of the things that we need to have throughout a lifetime is the natural curvature in the low back. Another thing is proper alignment. So the bones can't be misaligned one on top of the other. There needs to be proper alignment. Another thing is motion. There must be motion between the bones and between what we call the discs that are holding the bones and helping to stabilize them. So one of the things that can happen is, of course, a misalignment. You can lose the natural curvature, or you can misalign some of the vertebrae. If that happens, you may start to lose motion in the area, and you may start to experience nerve interference. And the term chiropractors use for this is called subluxation. It's a very devastating condition. Unfortunately, it may not always be painful when it happens. Now, I say unfortunately because the body uses warning signals to let you know when something is wrong. And if something's wrong and you don't get a warning signal, you may think that your spine is okay. So let's take a look at our next slide. What stresses a back? What could happen that causes this subluxation process? Well, as you'll see various topics coming up on the screen, it can start with something as simple as the birth process, or a slip and a fall. Gravity could affect you, or a car accident, or a sports injury. Other things you might not actually have thought of, and that would be medications or preservatives. That's chemical stress, or some type of emotional stress. Even not being breastfed could affect the way that your spine develops and a healthy back. So basically, there are 3 topics of stress that will affect your spine. The easiest one to think of is, of course, physical stress. The others are emotional stress and chemical stress. And remember that stress is good for the human body and for the spine to a point. If we get too much stress in our body, though, some of the structures and eventually the nervous system will start to suffer as a result of stress. Let's take a look at our next slide. Every day we injure our backs. Here's some common examples. How about a mom that's picking up her children and positioning the child on the hips. I see that one every day. How about a dad at the workplace in a rush, reaching over to grab a paint bucket or some type of heavy object and not taking care to have the proper lifting and posture techniques. These can be devastating either in the short term, or in the case of the mom, she might not feel it right away, and it could take quite a while for that posture to actually affect her in regards to pain. Let's take a look at our next slide. Back pain, are you the cause? Here's some other examples. On the workplace, leaning over and bending, some type of mechanical dysfunction. Certainly construction workers, carpenters, but all kinds of people are subject to those types of stresses. And then there's the office worker. It's estimated that 7 out of 10 cases are due to postural fatigue and spinal strain. And of course, these are all instances of physical stress. The other ones that you're not seeing here are the emotional stress that occurs on the job site or in the office. And what that can do, what emotional stress can do, is really lead to a lot of tension in the muscles. We all know how we felt when we're under incredible emotional stress. And the tendons, the ligaments, the muscles can really tighten up in the body, and that prevents the proper movement of the spine. Remember I mentioned before, there has to be proper motion in the spine to maintain a healthy back. If you lose motion, if things become very tight, then it doesn't move properly and it might get pulled out of alignment. So then when there's an alignment issue. And then eventually the curve might be affected, and then the nervous system itself. Remember, your nervous system is responsible for sending messages back and forth on a continuous basis. If the spine affects the nerve, that's known as a subluxation. Let's take a look at our next slide. Now, what else is affected? Companies are affected. Remember that a worker's strength and health many times is related to their spine. The spine is protecting the nervous system. Now, we need healthy backs in order to be productive workers. And we need productive workers in order to have healthy companies. Lots of innovative products. The strength of the company, even the longevity of the company, is based on their employees' health. And as you can see, the arrows go back up, and as the company increases profits and longevity, the workers are rewarded, and this should be an ongoing cycle. And many, many employers and managers know the cost of disability and workers' compensation insurance and workers' compensation payments. So I think if there's any managers or employers out there, they would agree that a healthy back is very important, and they know the devastating effects of having the workers laid up for weeks and months, possibly even years, disability, and the effects on the company. Let's take a look at our next slide. Here's a picture of the low back. You're going to see some bones lined up, and that second arrow that comes in, that's the unhealthy vertebra right there. It's been misaligned. You'll see the nerve above it is big and plump and healthy, and the one below it is thin and wiry. And that's what happens when you get a chronic misalignment, is that the nerve gets affected. The misaligned joint causes pain. And remember what I said before, hopefully there's some pain involved. If this goes unattended, then big problems can ensue. Let me grab my spine one more time and show you that the nerves are exiting from, and if you can see on your television, I'll try to make this easy, the little nerves exit from the spaces between the bones. So there's a natural curve and there's natural alignment. The brain sends down an extension of the spinal cord, and then little nerves come off the side, and that's how your body communicates with itself. If you have a spinal injury, a mechanical injury, where the bones are pulled out of alignment or the curve is affected, okay, a couple different ways, then what can happen is the nerve is affected. And that's a big, big problem. Let's take a look at our next slide. This one you're going to see posture. Now posture is one of the things the chiropractors emphasize on a daily basis. Here's some of the things that can happen. A lack of neck curve, scoliosis, that's a lateral curve of the spine, uneven pelvis, short leg, forward head tilt, rounded shoulders, that internal bending of the shoulders, slouching, and then too much or too little of a back curve. And remember, your posture is a mirror to your spine. So if your posture is affected, and I'm going to give you some demonstrations here, if your posture is affected, your spine has to be affected. You'll see people out there with their head turned. You'll see shoulders uneven. From the side, what we'll see is head forward posture. That's very common. We'll also see pelvis forward and the upper back going backwards, and then maybe even the head forward. So to maintain a healthy back, one of the main things that you can do is be aware of your posture and then maintain a healthy posture throughout a lifetime. It's not something that your mother or your grandmother wants you to do. It's very important to your health. Your mother and grandmother know best. Now let's take a look at a chart about posture. Here you'll see all the way on the left is a very normal, healthy posture, and the ear is lined up with the shoulder. Now you should maintain that posture throughout a lifetime. But many times what happens is the head gets out in front of the shoulder. And when that happens, we start to see changes. We start to see changes in the upper spine, and we start to see changes in the curve of the neck. Now, when that is left like that, gravity starts to take over. Remember, gravity is a force that's always there, and it will now take advantage of the fact that your head is out in front of your body. And as time goes on, you may end up like the last gentleman there, with his head steeped forward, with lots of problems in the spine, and very little chance of getting your proper posture back. So the time to act is now. And as the sentence says underneath, to live a long, active, energetic life, few things matter more than good posture. Let's take a look at our next slide. Let's look at the curve. Here's an x-ray of a low back. Now what's important about the curve? If you maintain the curve in the spine, these are some of the things that you'll be rewarded with. Strength in the low back is first of all, flexibility throughout a lifetime, resilience for the discs, which are actually shock absorbers for the bones, and then you'll have proper openings for that nerve flow. Remember, we said that's essential for life. Another thing is good circulation. There's arteries and veins moving through there, and we must have proper blood flow. So the question is, do you have a good curve in your low back? Do you know? Let's take a look at our next slide. You want to act before it's too late. Remember, weight-bearing joints degenerate first. And when we say degenerate, we mean things like osteoarthritis. The spine, the hips, and the knees are very susceptible to osteoarthritis because of wear and tear, weight-bearing processes. But there are steps that you can take to limit arthritis. And remember, degeneration can occur within 6 hours of immobilizing a joint. The process starts that quickly. Poor posture can result in degeneration. It doesn't have to be a traumatic car accident. It could be something simple where every day you are contributing to degeneration due to poor posture. Let's take a look at our next slide. Here's something that's very important, and that's prevention and proper lifting. A couple of different categories will come up here about how to lift properly, and I'm going to read those, and then I'm going to demonstrate myself. You want to use your legs. You want to take your back out of the lift, really. All your strength comes from your hip and your knees. No twisting or leaning forward. Keep objects close to your body. Here's one that not many people know. Tilt your head back and look up as you're lifting your object. Exercises are important on a daily basis, and always keep your back extended, not flexed forward. So let's take a look and see what that would look like in person, and I'll try to demonstrate for you. And I have the foam book here, and this would be a good demonstration. Say we drop something and it goes to the floor. Now we can do a couple different things. We can bend down quickly and keep our knees locked, and that would be an example of improper lifting. And we don't want to do that. First thing we want to do is get in front of the object, and we want to bend our knees while keeping our back straight. So we're going to go down like this, and now we're going to make sure that the object is as close to us as possible. So if it's far out, we want to pull it towards us, or we want to just inch up a little bit forward. Now, we can do it improperly and put our head down. That's that flexed position. Or we can grab the object, pull it in close, and arch back and look up towards the sun as we're pushing with the legs. Now that's an example of proper lifting technique. You notice one of the things I didn't do was twist the spine as I was lifting. And let me give you a good example of twisting and hurting yourself. Certainly in Vermont, people shovel snow. That's one of the worst things that you can do, especially if you're doing it improperly. Many people forward flex their spine and lock their knees, and then what do when they have that shovel? They're twisting their spine. That's how you're going to get yourself in a lot of trouble, and you will not have a healthy back if you shovel a lot of snow, and certainly if you do it improperly. To do it properly, you would want to go down, shovel, lift, and then somehow throw the snow. And that's typically not what people do. And I mention this every winter to all my patients because I think it gets people in a lot of trouble, and it's something that can happen for many, many months, certainly up here where it snows all the time. Let's take a look at our next slide. Did you know it is far better to wear out the soles of your sneakers than the sole of your discs? Past age 12, your discs, that's the shock absorbers between the bones, have zero blood supply. And without spinal stretches, or what we call range of motion, and spinal hygiene, that's taking care of your spine for a lifetime, those discs can become brittle. They can become misaligned, and if they don't have their proper nutrient flow, trouble starts to occur. So how does a disc get its nutrients? It absorbs it from the surrounding area. That's why we need motion. Let's take a look at our next slide. Certainly if you are injured, we want to avoid re-injury. So what can you do? Well, stretch your back daily. I have a lot of trouble, even as a doctor, encouraging people to stretch on a daily basis. And I'm sure you know, sitting at home, you're all guilty there, that people do not stretch on a daily basis. Now, you want to do your stretches regardless of pain, and they have to be simple to do. So I will give some simple stretches to my patients, and I'll provide a few today. But you must understand why you're doing the stretches. A lot of times, chiropractors talk about the subluxation and spinal problems, and we relate it back to dentistry and the teeth. See, everybody knows what a cavity is, and we know to brush every day and how to prevent cavities. So it's something you do on a daily basis, and that's called dental hygiene. Spinal hygiene is much the same. So chiropractors emphasize stretching and moving, proper posture, and then checkups would occur not with the dentist, but in this case with a chiropractor. Remember, those joints need to be motioned because it will help nutrients come into the area, and that limits the degeneration process, which we call osteoarthritis. So that's the cavity of the spine, osteoarthritis. That's a wear and tear, and it basically occurs as you age and you misuse the spine. Let's look at our next slide. What are some of these stretches? You may have difficulty seeing these on your screen, but I'll talk about them briefly. And that would be to be on all fours, much like a cat or a dog. And you've seen cats when they wake up in the morning and they do a full stretch and they arch their back and they drop their head and then they drop their belly and they look up. And that's a basic stretch that's very good for the spine. It helps to get a lot of motion and movement into the joints, and that's a great one that anybody can do. Another simple one is the knee to chest. And what we want to do is lie flat on our back and pull each knee up individually towards our chest and breathe. Count to maybe 8 as you're pulling up and holding the knee to your chest. And then you want to bring both knees up and end and do one of those. And you can alternate back and forth. Another simple low back stretch. And another one is for strength is really the crunch. Not the full sit-up where you're bringing your whole body off the floor. That's old school. What they teach now is, what we teach is to just bring your upper back off of the floor and looking forward and holding for an 8 count. And you'll really feel it, if you're doing it correctly, you'll feel it right in your abdominal muscles. And that helps the low back. Remember, your abdomen is the front of the low back, and it's important to keep those muscles strong. Let's look at our next slide. Now, what happens if you are injured? The choice is yours. Where are you going to go? I recommend chiropractic adjustments and not taking medications. Many times, medications are covering up the underlying injury, and many people will not get the proper care but will cover up the pain with medications. Well, what else can you do? Posture, okay? I talked about this previously. Maintaining proper posture throughout a lifetime. That's seated and standing, and there's even a proper posture while you're lying in bed. Sleeping face down would be an example of improper sleeping posture. Of course, there's stretching, and you want to avoid things like long-term bed rest. It really doesn't help the low back. Of course, surgery is an extreme option, and other things that you can do would be exercises, and of course we talked about modifying and perfecting your lifting techniques. Let's take a look at our next slide. What do you presently do on a daily basis that enhances the quality of messages sent from your brain to your body parts? Now this is really where chiropractic begins and ends, because we're really concerned about the structure of your spine, but also the function of your body. Do you continually check your posture? Are you doing posture maintaining exercises? Have you ever even thought about posture maintaining exercises? Do you constantly adjust and retune your workstation, your car seats, your bed and your pillows, and your computer screen? And do you have your spine checked by a specialist, in this case a chiropractor, who is the true spinal specialist? Let's take a look at our next slide. In closing, what I'd like to say today, what we've learned about is how to maintain a healthy back. And what happens if it's injured? How do we prevent it? And what are our treatment options if it is, in fact, injured? Let's review a couple of the structures. Remember, the bones of the spine must have a proper curvature in the low back. It's a concave curve. And there must be proper alignment. We can't have bones going all different directions because that leads to something called subluxation. That's where the bone, the misalignment, starts to affect the nerve coming out between the bones. That can affect your body's function. So ultimately, your structure determines proper function. Now, if you're injured, my recommendation is to seek help with a chiropractor immediately. We take things like x-rays to determine proper curve and proper alignment, and have other tests where we can determine if you are suffering from subluxation and the effects of subluxation. If you would like any more information about living with a healthy back, or if you do have low back pain, please don't hesitate to call me. I'm on Pine Street in Burlington, and my phone number is 951-5700. Thanks for watching. Have a great day.